One of the big things with advocacy is you've got to know what you're doing before you can go out and fight for the right to do it. So anyone can go out and advocate for this amazing profession, but you have to know how to safely do what you're fighting to do before you understand how to truly fight for it.
Hey, future CRNA, welcome to the CSPA podcast. CSPA has helped over 3,000 nurses like you gain acceptance into schools across the country. Tune in for inspiration and actionable takeaways to help you from start to finish. Hello, future CRNA. Welcome back to CSPA podcast. Today, we're going to dive into professional roles and leadership in nurse anesthesia. This topic today is going to be brought to you by Dr. Melissa Eisenhauer through the University of Evansville. Dr. Melissa Eisenhauer began her nursing career with an associate's degree from Kentucky Wesleyan College in 1997, and then she earned her BSN from Murray State University in 1999. Driven by her passion for nurse anesthesia, she graduated from Murray State University in 2002. And for 17 years, she worked as a CRNA servicing rural facilities across Western Kentucky. In 2019, she became the founding administrator for the Doctor of Nursing Anesthesia Practice program at the University of Evansville, leading the program to accreditation in 2021. Dr. Eisenhauer is a strong advocate for the profession, serving as an incoming president of the Indiana Association of Nurse Anesthetists, contributing to State Organizational Development Committee of the American Association of Nurse Anesthetists. Outside her work, she enjoys traveling, time at the beach, being with her 2 children, and she's also recently married. So sending a huge congratulations and sincere gratitude for sharing your knowledge with our soon-to-be CRNAs.
Hello, my name is Dr. Melissa Eisenhauer. I'm from the University of Evansville, Nurse Anesthesia Program in Evansville, Indiana. And today I just want to talk to you a little bit about how to develop your professional role and leadership skills if you are looking to go to anesthesia school, which I believe most of you are. So let's get started. I think before we can truly get into the development of the role of a CRNA and how to lead in the field, I think it's important for us to take a quick look at the history of the profession. And we do, as nurse anesthetists, have a very storied history. In the photo on this slide, you'll see Alice McGaw. Alice McGaw was dubbed the mother of anesthesia by Dr. Charles Mayo. Her leadership in what was considered a new field in her time drew more widespread attention than that of any member of the Mayo Clinic, apart from the Mayo brothers themselves. So she was actually the first to really draw attention to nurses performing anesthesia. Back in the 1930s, George Cryle, a physician, he was actually one of America's greatest surgeons, was renowned for his research in the treatment of surgical shock. And he was a staunch supporter of nurse anesthetists and actually chose a lady named Agatha Hodgins to be his personal anesthetist. He, was known to say that he felt that the movement of nurse anesthesia was one of the most beneficent movements we had seen in the whole field of operative surgery. He felt that Agatha Hodgins was brilliant, called her a woman of vision. So it was very fitting that she was elected the honorary president of the National Association of Nurse Anesthetists in 1933 at its first meeting. The NANA, or National Association of Nurse Anesthetists, actually started June 17th, 1931 in Cleveland, Ohio, but they did not hold their first meeting until 1933 in Milwaukee. There were 120 individuals in attendance, and that's when Agatha Hodgins was elected the honorary president. There are 3 primary professional organizations in nurse anesthesia. We've got the American Association of Nurse Anesthesiology. You'll see on the slide, I have an old logo there that still says American Association of Nurse Anesthetists, but we are now known as the American Association of Nurse Anesthesiology, or AANA, the Council on Accreditation of Nurse Anesthesia Educational Programs, and then, or what we call the COA, and the National Board of Certification and Recertification for Nurse Anesthetists, or the NBCRNA. So let's talk a little bit about these. So the American Association of Nurse Anesthesiology, or AANA, I've got the link there. So that if you have access to these slides, it's easy access for you to go to the website. But it's the single professional organization in the United States that truly represents the interest of CRNAs in the country. Its mission is to promote full scope of practice for CRNAs and to promote healthcare policy that supports nurse anesthesia practice. It is based in Rosemont, Illinois, And then we also have a federal government affairs office in Washington, D.C. In the late 1920s, 44 CRNAs from 12 states agreed to form the National Association of Nurse Anesthetists, which we talked about in that previous slide, in an effort to affiliate with the American Nurses Association. That affiliation actually never happened, so we just moved forward over the years until we became the AANA. And again, Agatha Hodgins was the first president of the NANA. Objectives of the American Association are to promote continual high-quality patient care. We always want to advance the science and art of anesthesiology. We want to develop and promote educational standards in the field of nurse anesthesia, promoting standards of practice in the field of nurse anesthesia, facilitate effective cooperation between nurse anesthetist, physician anesthesiologist, and other members of medical professions, because we do work very closely with all professions within our healthcare system. The nursing profession, hospitals, the hospital association, and then those agencies that represent communities of interest in nurse anesthesia. The AANA encourages publishing of scientific journals, bulletins, and other publications that are pertinent to the objectives of the association. They help to maintain informational and statistical data for reference and assistance in matters that pertain to our profession and clinical practice issues. They provide lots of opportunities for continuing education, and then to provide us as members with direction pertaining to governmental policies and governmental affairs that are of importance to anesthesia and anesthesia providers. There are many benefits and services to AANA members if you are a paid member of the AANA. They do their best to keep us aware of any issues that may be going on behind the scenes. And in addition to that, help us to keep the public aware of the profession of nurse anesthesia. They provide support regarding business and clinical practice issues, government affairs activities. Again, there are publications that inform and educate both the public and the membership. We have several national meetings annually, and I'll talk a little bit about those in a few minutes. Provide support for nurse anesthesia education, quality and patient safety, and continuing education activities. And they will actually record our Class A continuing education credits. They provide support for research. There's the AANA Bookstore and Resource Center. The website itself has just a wealth of resources for its members. AANA online services, and then there's the AANA insurance services area that offers members reasonable pricing for liability insurance and other types of insurance, I believe. As I mentioned, there are several AANA meetings annually. Why is it important? Why do we need to go to meetings? People talk about, being busy, and I don't want to attend something else. I don't want to sit through another lecture, but it is really important to attend these meetings, and it's easy to become involved. The Mid-Year Assembly is probably one of our largest and most important meetings each year. It's held annually in Washington, D.C., usually in April. CRNAs have the opportunity to come together, meet together, and then separate as state delegations to meet with their elected national congressional delegation, and to really just be able to directly lobby our AANA federal legislative agenda to our legislators. Discussions include healthcare reform, federal policies and law affecting healthcare cost, assessment, and quality. So when we arrive in Washington, D.C., the first couple of days of that meeting is time to just prepare us as CRNAs on issues and how to best talk with our congressional members and staff when we do have those face-to-face meetings. Annual Congress, of course, is held each year, usually lasts about 5 days in early to mid-August, always in a major metropolitan city. I'm super excited because 2025 Annual Congress is going to be held in Nashville, Tennessee, which is just a couple of hours from me. So I will definitely be there. Large attendance, and usually includes over 1,000 students. There are a lot of activities for students, including the College Bowl. There's a student luncheon. There are mentoring opportunities for students. And the networking is just amazing. This meeting includes AANA opening ceremonies. There's general business session, bylaws hearings, scientific sessions and workshops, focus sessions concentrating on special issues. There are exhibits, receptions. It is really a full 5 days of just amazing networking opportunities and learning opportunities. Leadership opportunities and committee involvement are huge within our profession, and there are countless opportunities to become involved. We at one point had the leadership summit annually. It was one of our annual meetings. Now, beginning this fall, that former leadership summit is being replaced with leadership boot camps at the AANA headquarters in Rosemont, Illinois, and those will be held for state presidents and presidents-elect, and really just to do exactly what the title says, boot camps to help train these individuals and give them a strong foundation in state leadership and how to best guide and direct their membership in their state. There are numerous elected and volunteer committees within the AANA that offer opportunities for involvement, development of leadership skills, insight into how the association is run. But the one thing that I always tell my students and that I encourage everyone to really think about is that we stand on the shoulders of giants in this profession. I can think of, we talked about Alice McGaw, we talked about Agatha Hodgins, Nancy Bruton-Marie, Sandy Marie-Ouellette, Jackie Rolls, and those are just to name a few right off the top of my head. These individuals have done so much hard work over the years. They got us to where we are today. And so getting involved and staying involved today is the only way to carry on the work of those before us. And so I really always push these leadership opportunities with my students, and getting involved on committees. I myself have served on a national committee. I was on the state organizational development committee. I learned so much. It was a wonderful opportunity for me. There are opportunities for student involvement on national committees as well. And then it just really lays that foundation for involvement once you graduate and become a CRNA. We move on to the National Board of Certification and Recertification for Nurse Anesthetists. Now, it's important to note that these professional organizations that I'm talking about are separate. They're individual organizations, okay? We all kind of try to work together, but these are separate organizations with different goals. So the NBCRNA represents the community of interest involved in the process of certification and then recertifying CRNAs every few years. They formulate the requirements, guidelines, and prerequisites for certification and the eligibility to take that national certification examination that you will take after graduation from an accredited program. They actually administer the NCE and evaluate performance on that and grant initial certification to those individuals who successfully complete the certification exam. They formulate and adopt the criteria for eligibility for recertification based on the CRNA's participation in those continuing education activities and recognized activities that show that we are professionally proficient. And then continue to formulate and adopt those criteria for recertification requirements as recommended by one of those committees that we talked about, the AANA Continuing Education Committee. Now we'll move on to the Council on Accreditation of Nurse Anesthesia Educational Programs, or the COA. It's one I've become extremely familiar with since becoming a program director in 2019. The COA actually represents the community of interest involved in the accreditation process of educational programs. Their purpose is to advise, formulate, and adopt standards, guidelines, procedures, and criteria for accrediting nurse anesthesia educational programs. The big responsibility there is to ensure to our public that educational programs of nurse anesthesia are high quality and that we remain compliant with sets of minimum educational performance standards. One of the important things to note there, and because you're involved with the CRNA School Prep Academy and you're looking into anesthesia schools, you are likely aware that all accredited programs must have transitioned to a doctoral degree for entry into practice by January 1st, 2022. So after the year 2015, the COA no longer considered master's degree programs for accreditation. So all programs now are doctoral degree for entry into practice. State organizations are extremely important because your state nurse practice acts determine how CRNAs can practice in their particular state. So becoming involved with your state organization and familiarizing yourself with your state's nurse practice acts will give you a solid understanding of your practice rights and responsibilities where you live and work. State organizations are formed by members who live and work in that particular state. They're recognized by the board of directors as a duly incorporated entity. They are responsible for organizing their own committees, for electing state officers, and handling their own financial affairs. They're supported financially by state membership dues, which the AANA collects. So part of your AANA membership, each individual who pays an AANA membership, part of that comes back to the state as your state dues. Members from state associations maintain contact with the national office. We provide the national office each year with a list of our new officers, committee members, bylaws, things of that nature. I think it's important to get to know your state organization board of directors as well. As a 5-year member of the Indiana Board of Directors now, I can tell you there are limitless opportunities for involvement. When I came to the state of Indiana, I joined the board that first year that I came here in 2019 as an at-large director, and I remained in that seat as an at-large director for 3 years, and then was elected to the president-elect seat, and then have been the president in this 2024 fiscal year. So my presidency will end in October when we have our fall meeting, and I will remain on the board in a non-voting capacity for the next year then as the immediate past president. So there are so many opportunities, committees, program development for state meetings, things like that, for involvement. And I can tell you that your board of directors in your state, they want to hear what the membership wants. They want to hear, what issues do you want to fight for? What do you want us to talk to legislators about when we go to our state capitol buildings? So I highly encourage you to get involved with your state organization, find out who's on your board, and ask how you can help, because I promise you there are ways you can help. Advocacy, obviously, because I have served on the board, I have served on committees. I am a staunch advocate for the profession, both at the state and national level. So who advocates for us in our profession? Well, these organizations that we've just been talking about. They are all in place to assure that we have individuals on our side to fight for our practice rights, to ensure that our anesthesia programs are of the highest quality, and to assure that our certification standards are maintained. And how can we best advocate for our patients? Well, by maintaining our certifications, by continuing education opportunities, by networking and continually learning and being the best clinicians and practitioners that we can be. It's always my hope for those of you who are embarking on this educational journey that you grasp one crucial aspect of professional advocacy. And this is something I share with every student that comes through our program, and specifically when they take our professional role and leadership development course. You must be able to safely administer an anesthetic and be a competent and vigilant provider before you can advocate for the right to provide that care. You've got to be able to walk the walk before you can talk the talk. And that's one of the big things with advocacy, is you've got to know what you're doing before you can go out and fight for the right to do it. So anyone can go out and advocate for this amazing profession, but you have to know how to safely do what you're fighting to do before you understand how to truly fight for it. So that's, where our anesthesia training programs come in, and keeping curriculum strong and robust, and, making sure that our clinical preceptors are strong and working with our students daily, providing, feedback that helps us to help our students. Leadership, is an integral part of graduate education and the development of the professional role of the CRNA. And so within the professional role and leadership development course at the University of Evansville, I utilize the Quantum Leadership, Creating Sustainable Value in Healthcare textbook. So in the next couple of slides, I really just wanted to share a couple of key points that I try to drive home with my students. And if you're looking to become a CRNA, I want you to not only become an excellent clinician, but a strong leader of change in your community, and then that will carry over into the profession as a whole. One of the quotes that I like in the Quantum Leadership textbook says, "The hardest thing is not to get people to accept new ideas. It is to get them to forget old ones, and that was from John Maynard Keynes. This current generation has seen the development of fiber optics, virtual universities, and online classes, and cloning, and custom DNA-based treatment modalities. I could go on and on. There's so many more things than, we would even have time to discuss. Change is often coming so fast that we can't often fully comprehend how these changes might affect us. For instance, I think society really is truly just starting to understand the impact of social media on our beliefs, knowledge, communication, business, and politics. I mean, we wake up in the morning and the first thing we do is click on some form of social media, and that's kind of where we get our news. It's probably different when we wake up in the morning than it was when we went to bed the night before. So it can be really overwhelming and difficult to keep up with that. So the key point here is that communication technology has created a world without boundaries often, and we have to learn to create our own self-limiting boundaries in a way that will produce balance among those conflicting demands of our lives, and we are all pulled in so many directions. Effective leaders must be operational experts and problem solvers. Operational experts meaning, in our field, we've got to be great clinicians. We've got to be strong clinicians and know how to operate in our field. And then to solve problems, often very, very quickly. We must be good signpost readers. I'll come back to that in a minute. Anticipate the path of change and then spell it out for those who are moving their own activities, whether they know it or not, in the same direction as real change is taking form. Effective leaders must demonstrate comfort with the journey and provide a framework for leading others through what often feels like chaos and uncertainty in a world of constant change. And we must exhibit behavior that exemplifies commitment to sustain their own journey and to coordinate and facilitate the efforts of others to build a desired future. To be an effective leader, you have to be the stronghold for others, and that can get exhausting, and it can be very daunting at times. But, again, we stand on the shoulders of giants, and so someone has to carry on those leadership skills and abilities to the next generations. So let's go back to that stop sign or that signpost reader quote. A stop sign can be used to illustrate what is potential reality, right? When you first see a stop sign, it notifies said driver to stop, but not immediately. The sign is a real object. It's a reality. It does require a real response, but the driver's preparation to stop is the first in a chain of actions. But it's only when they actually arrive at that stop sign that the act of actually stopping becomes real. So seeing the sign and preparing to stop is acting in consonance with that potential reality. Actually stopping at the sign is what represents the actual reality. So I guess what I'm getting at here is there's a lot of preparation that goes into that decision making and that actual full stop of the actual reality. There's a lot of potential that's happening before you get to that actual reality and that actual event taking place. Leaders are agents of change. They are responsible for providing others with a vision of change and ensuring that their response aligns with the demand for change, which in today's day and age seems pretty constant. Leaders are those who know that the realities pertaining to a change process, and they can adapt that process in light of those realities so that the needs of key stakeholders are met and stakeholders can devote their efforts to implementing and sustaining processes. Before I get into talking a little bit about our program, like I said, with that quantum leadership textbook, I just wanted to give you a few highlights there and a few of the key takeaways just in the early chapters. So if you want to know more about what happens with quantum leadership and sustaining value in healthcare in today's day and age, well, you're going to have to come to the University of Evansville and be in my class to find out. Again, I mentioned early on that I'm at the University of Evansville Doctor of Nurse Anesthesia practice program. Part of this presentation is to kind of talk to you a little bit about our program and what we offer. And we are very excited to be offering this program in Evansville as one of only 2 programs in the state of Indiana. Where is Evansville, Indiana? Well, it is the third largest city in Indiana, population of about 118,000. There's a tri-state area that we serve, 11 counties in Indiana, 10 counties in Illinois, and 9 counties in Kentucky. And that entire catchment area is listed as medically underserved. There are no nurse anesthesia programs in the state of Indiana within an hour of the University of Evansville. And we are pretty strategically located within about 3 hours of Nashville, Louisville, St. Louis, and Indianapolis. So lots of things to do around us and pretty easy to get to some of those bigger cities. The university itself was founded in 1854. It's a not-for-profit private university with a total enrollment of a little over 2,500. We have a beautiful campus that covers 75 acres and 31 buildings. Some of the services on campus include a full library, a fitness center, intramurals, counseling, health clinic, bookstore, and of course all the students love the Chick-fil-A. Some just kind of quick facts about our program. So we're accredited to offer a Doctor of Nurse Anesthesia practice program by the Higher Learning Commission. We are also, of course, accredited by the Council on Accreditation of Nurse Anesthesia Educational Programs. The first year of the program is didactic and clinical rotations are incorporated into the second and third years. However, just last year, we added 2 courses for academic credit entitled Preclinical Practicum 1 and 2 that allow students some shadowing opportunities in our 3 primary clinical sites. And this allows students to really orient to those sites prior to beginning clinical rotations. We also hold a clinical boot camp of sorts within the second preclinical practicum to ensure that students are ready to hit the ground running when their rotations begin. We are a 36-month year-round curriculum. We have some amazing faculty and staff. We have classes offered on our main campus in Graves Hall, and then with physician assistant students at the Stone Family Center for Health Sciences about a mile off of our main campus. We have put together a very state-of-the-art simulation lab, offering our students hand-on experiences prior to providing actual patient care. This is just some of our students. I like to show them off performing ultrasound for an arterial line lab. We purchased the quad system from Intelligent Ultrasound about a year and a half ago, and this is some students performing fast exams. This is BodyWorks Eve, and this is actually another part of the Intelligent Ultrasound training system where we can train students on point-of-care ultrasound guided techniques. Here we have another part of the Intelligent Ultrasound training system. We're able to train students on TEE and TTE techniques as well. Here you see a dual screen, so there are actually echocardiography images that come up on one screen with actual cardiac images that were taken from patients on the other screen. And then again, this is also used with the BodyWorks Eve part of this system to allow students practice in point-of-care ultrasound. One requirement for students to graduate from a nurse anesthesia program is to carry out a doctoral scholarly project, and that includes dissemination. So these gentlemen are part of our current senior class, and their doctoral scholarly project centered around diversity in nurse anesthesia, and they took part in several workshops. They were part of the Medical Professions Academy, which is part of the Evansville Vanderburg School Corporation, with middle school students, going and talking to those students about nurse anesthesia and what it actually means to become a nurse anesthetist. They visited nursing programs and really tried to help build a pipeline into the nursing program that would lead in then to nurse anesthesia. Our program is pleased to have developed 3 primary clinical partnerships. We have Deaconess Health System and Ascension St. Vincent Health System, both here in Evansville, and then the Owensboro Health Regional Hospital in Owensboro, Kentucky, that serve as our 3 primary clinical sites. We also have affiliation agreements with more than 25 clinical sites across Indiana, Illinois, and Kentucky, and we are continuously working to add more sites to our list. Requirements for application can be found on our website, but you have to have a Bachelor of Nursing from a regionally accredited school of nursing, unencumbered license to practice nursing. We will talk you through getting an Illinois license prior to starting clinical rotations. Indiana and Kentucky are compact states, so it's a little easier there. 1 full-time year, although we prefer 2 of ICU experience at the bedside within the last 5 years. We do require employer require verifications, ACLS, BLS, and PALS, 3.0 undergraduate GPA. Undergraduate courses that we require with a B or better are a basic statistics and chem class. We do require a couple of different shadowing experiences. There's a writing prompt on our website, 3 professional letters of reference, and we do require CCRN for acceptance into our program. And our application can be found on Nursing CAS. Certainly, if you have any questions about our program, reach out to me. My information is here on this last slide. Our program has an operations administrator, Miss Missy Holtzmeyer. She is excellent with providing information, setting up visits. We hold open houses quarterly to allow potential applicants to come in and visit our program and kind of show off what we feel we do really, really well. So I wish you the best of luck in your journey. I hope that this discussion on professional development, a little bit of the history of nurse anesthesia, how we got to where we are and why it's important to continue on that path was beneficial to you. If I can ever be of any help to you, please don't hesitate to reach out.
Thank you for tuning in. Be sure to head over to CRNASchoolPrepAcademy.com to gather free resources to help you on your CRNA journey. Stay strong. We're rooting for you, future CRNA.